What does society do when one person's behavior puts the greater public at risk? We make them stop. You don't get to drink and drive. You don't get to smoke in public places. And you don't get to leave your house if you catch some infectious disease. But then what should we do about the people who decline vaccinations for themselves or for their children and put the greater public at risk? People who decline vaccinations for themselves or their children are scared of the outcome of these vaccines or even the diseases. But isn't that the same thing? Yes, it is. The main points of my speech will be informing you of diseases that have broken out without having vaccinations, the pros and cons of being unvaccinated, and what we as a society can do about this. The evidence is overwhelming that declining vaccinations are contributing to outbreaks of disease. Declining vaccination is bringing back diseases that we as a society haven't had to worry about for years. Take just one example, measles. The European Center for Disease Control reports outbreaks in many countries where vaccination rates have gone down. The United States has seen 156 cases as of mid-June, compared to a total of 56 cases per year from 2001 to 2008. The Centers of Disease Control and Prevention have an emergency health advisory out for measles, a disease that was officially declared gone in the United States in 2000. There are many potential solutions, each of course with pros and cons, and details that require study and very careful thought. Declining vaccination or accepting vaccination is a big topic and an even bigger discussion, which is why it should be discussed openly. People who are for vaccination obviously say that it's safe and one of the greatest health developments of the 20th century. Others who are against vaccinations say their immune systems can fight off the infections naturally. There are plenty of facts to support those who are for vaccinations for themselves and children, such as vaccines can save children's lives. The American Academy of Pediatrics states that most childhood vaccines are 90 to 99% effective in preventing disease. But there is also plenty of facts to support those who are against vaccinations, such as vaccines can cause and sometimes fatal side effects. According to the Centers of Disease Control, all vaccines carry a risk of life-threatening allergic reaction in about 1 per million children. I can give you all of the facts in the world, but what really helps is having ideas of how we as a society can fix this situation. It is appropriate and urgent that we act to protect ourselves from those choices about vaccinations are putting the rest of us at risk, and do the same thing society always does whenever one person's behavior or choices endangers the greater community. We make them stop. There are a few potential solutions for this situation, such as vaccinations should be required for anyone who wants to work in the healthcare. There should be a higher health care or insurance cost for unvaccinated people, or maybe reduce the health care or insurance costs for people who do get vaccinated. This isn't about creating more government to intrude further into our lives, but about calling on the government to do what's right for all of us, to protect us from actions of others when we can't protect ourselves as individuals. In conclusion, declining vaccinations are bringing back diseases that we as a society haven't had to worry about for years. Declining vaccination or accepting vaccinations is a big topic and an even bigger discussion, which is why it should be discussed openly. It is appropriate and urgent that we act to protect ourselves from those whose choices about vaccinations are putting the rest of us at risk. The safest and most effective vaccines are of little use if too few people take them. Public support for immunization remains high in most industrial countries, but vaccine scares will continue, which is why it is up to us as a society and government to come up with a plan.